Please, Dr. Monarez. Is your microphone on?
I believe it's on. Can you hear me?
Yeah. Close to the mic.
Thank you. Okay. Chairman Cassidy, Ranking Member Sanders, and distinguished members of this committee. Thank you for the opportunity to testify before you again. My name is Susan Monarez, and I am a microbiologist and immunologist. Exactly 12 weeks ago, in this same room, I testified that if confirmed, I would lead the CDC to restore public trust, modernize public health infrastructure, and strengthen the agency's core mission of protecting Americans from infectious diseases and emerging threats. I was honored to be nominated by President Trump and confirmed with the Senate support. Secretary Kennedy himself swore me in on July 31st, calling me a public health expert with unimpeachable scientific credentials. My tenure as CDC Director lasted 29 days. Since my removal, several explanations have been offered: that I told the Secretary I would resign, that I was not aligned with the administration priorities, or that I was untrustworthy. None of those reflect what actually happened. I will share the details, but I want to be clear. Today should not be about me. Today should be about the future of trust in public health. The events leading to my dismissal began weeks before August 25th. On August 2nd, I learned from media reports that experts serving as liaison representatives to the Advisory Committee on Immunization Practices, the ACIP, including those from major medical societies, had been removed from its working groups. The following week, I heard concerns that the ACIP might alter childhood vaccine schedule at its September meeting, potentially without credible supporting data. On August 8th, a gunman, driven by vaccine distrust, fired 180 rounds into CDC headquarters in Atlanta, killing Officer David Rose. In the days after the attack, I focused on security, staff, and ensuring the CDC could continue its mission. On August 19th, I received a directive from the Secretary's office that I now required prior approval from my political staff for CDC policy and personnel decisions. On August 21st, I was told to return to Washington from Atlanta immediately, which would have meant missing Officer Rose's memorial, something I was not willing to do. When I did return, I was concerned about my ability to continue to lead the CDC while preserving evidence-based decision-making, commitments I had made to this committee during my confirmation hearing. On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed. For 3 decades, I have worked at the intersection of public health, science, and technology innovation, always challenging the status quo and welcoming the changes that come from research and discovery. Even under pressure, I could not replace evidence with ideology or compromise my integrity.
Dr. Monarez, you're almost out of time. I'll be generous, but if you could speed up just a little.
Vaccine policy must be guided by credible data, not predetermined outcomes. As I wrote in my September 4th Wall Street Journal op-ed, I agree with President Trump. We should not hesitate to ask for proof about our vaccines. And I also agree with his most recent comments that vaccines are not controversial because they work. Demanding evidence is exactly what I was doing when I insisted CDC recommendations be based on credible science. I was never misaligned with the administration priorities. The goals Secretary Kennedy recently cited publicly, protecting the public from threats, building infrastructure, modernizing systems, investing in the workforce, and enhancing scientific rigor were the same priorities I articulated at my confirmation hearing and began advancing during my short tenure. I remain supportive of those priorities. The question is whether they can be achieved without the expertise required at CDC. Regarding trustworthiness, I cannot define that word for Secretary Kennedy. I made commitments to this committee that I would lead with integrity, transparency, purpose, and work with Congress to maximize health outcomes and protect the American people. Secretary Kennedy told me he could not trust me. I had refused to commit to approving vaccine recommendations without evidence, fire career officials without cause, or resign, and I had shared my concerns with this committee. I told the secretary that if he believed he could not trust me, he could fire me. The next day, I was told I still had my job, but the secretary's expectations remained: approval of ACIP recommendations and dismissal of career scientists. I would not commit to that, and I believe it is the true reason I was fired. Tomorrow, the reconstituted ACIP will meet. Its composition has already raised concerns from the medical community. Based on what I observed during my tenure, there is a real risk that recommendations could be made restricting access to vaccines for children and others in need without rigorous scientific review. With no permanent CDC director in place, those recommendations could be adopted. The stakes are not theoretical. We already have seen the largest measles outbreak in more than 30 years, which claimed the lives of 2 children. If vaccine protections are weakened, preventable diseases will return. I was fired for holding the line on scientific integrity, but that line does not disappear with me. It now runs through every parent deciding whether to vaccinate a child, every physician counseling a patient, and every American who demands accountability. I want to end where I began with my confirmation hearing. I spoke then about the value of hard work, paying my own way through college, and my lifelong dedication to science and public health. On August 25th, I could have stayed silent, agreed to the demands, and no one would have known. What the public would have seen were scientists dismissed without cause and vaccine protections quietly eroded, all under the authority of a Senate-confirmed director with unimpeachable credentials. I could have kept the office, the title, but I would have lost the one thing that cannot be replaced: my integrity. Some may question my motives or mischaracterize my words. That is part of public life, but I am not here as a politician. I'm here as a scientist, a public servant, and a parent committed to protecting the health of future generations. The question before us is whether we will keep faith with our children and grandchildren, ensuring they remain safe from the diseases we fought so hard to defeat: polio, measles, diphtheria, whooping cough, and many others. Undoing that progress would not only be reckless, it would betray every family that trusts us to protect their health. Thank you, and I look forward to your questions.
Dr. Houry?
Chairman Cassidy, Ranking Member Sanders, and distinguished members of the committee, thank you for the opportunity to testify before you today. 3 weeks ago, I made one of the hardest decisions of my career. I resigned from CDC. I come to you as a doctor, as a scientist, and a mom. For over a decade, I worked as an emergency physician, treating patients where I saw firsthand how illness and death devastate families and loved ones, and even more devastating when it's preventable. That's what led to my career in public health. I changed my focus from treating individual patients to protecting the nation. I served 10 years at CDC under 6 directors and 4 administrations. In each case, priorities shifted, but decisions were grounded in evidence, transparency, and consultation with the world's best scientists. That has changed. I resigned because CDC leaders were reduced to rubber stamps, supporting policies not based in science and putting American lives at risk. Secretary Kennedy censored CDC science, politicized its processes, and stripped leaders of independence. I could not, in good conscience, remain under those conditions. America's progress in health is one of the greatest success stories in history. A century and a half ago, life expectancy hovered around 39 years. Today, it is nearly double that. And we got there through vaccinations, through safer food and water, through smoking cessation, and through the quiet, steady work of public health in every state and county across the country. There is certainly still work to be done to improve the health of our nation. But when we erode the institutions and processes that deliver evidence-based interventions to detect, prevent, and respond to health challenges, as Secretary Kennedy is doing, we trade proven gains for avoidable harm. We know vaccines save lives, yet all 17 voting members of ACIP, the committee that sets vaccine recommendations, were replaced with critics. Flu campaigns were halted despite 270 pediatric flu deaths last season, the highest non-pandemic total ever, with 90% of those children being under or unvaccinated. We also saw the highest number of measles cases in 30 years, with 2 children dying. Instead of promoting vaccines, the secretary spread misinformation and promoted unproven treatments. CDC's labs and data systems are our nation's first line of defense against pandemics and biothreats. But those defenses are being weakened. Under the secretary, global flu sample submissions have dropped by 60% and COVID samples by 70%, leaving us with far less visibility into what's coming. At the same time, moving experts on birth defects and chronic disease out of CDC will fragment our response capacity. We learned during Zika and more recently with Oropouche that reproductive health expertise was essential in these complex infectious diseases causing birth defects. Due to the Secretary's actions, our nation is on track to see drastic increases in preventable diseases and declines in health. Trust and transparency have been broken. Here again, the problem is not too much science, but too little. I first learned that the Secretary had changed our CDC COVID vaccine guidance on an ex-social media post. CDC scientists have still not seen the scientific data or justification for this change. That is not gold standard science. The Secretary's office ordered the removal from our website of the CDC scientific document on thimerosal, an additive to vaccines that science has shown is not linked to autism, while allowing an unvetted presentation on thimerosal to happen at ACIP, containing scientific assertions that were not assessed for data quality and bias. That kind of last-minute alteration undermines confidence in the deliberations that follow and is certainly not radical transparency. While at CDC, I worked with thousands of the hardest working, dedicated people I know who come to work every day to help all Americans live safer, healthier lives. My goal today is to provide real examples of the damage CDC is experiencing and to offer constructive steps squarely within Congress's responsibilities. I look forward to your questions.
Dr. Monarez, I just entered into the record the op-ed from the Secretary and your report, and both of those suggest that you and Secretary Kennedy were actually pretty aligned upon CDC priorities. How many times did you meet with the Secretary in your 29 days? Be brief, I've got 5 minutes. Are you on?
Yes, can you hear me? I met with him twice. when he swore me in. He was in the room, he swore me in. And then I met him again on August 11th when he came down to tour the buildings that had been under the gunfire. And we chatted briefly.
And then you met the 25th as well.
And then the 25th. That's correct, yes.
Okay. And how many meetings were around the period of the 25th?
We had 3 distinct meetings that day.
Okay. And what did he tell you to do?
In the first meeting, briefly, in the first meeting, he asked me to commit to firing scientists or resign. He asked me to pre-commit to signing off on each and one of the forthcoming ACIP recommendations, regardless of whether or not there was scientific evidence.
And what were those recommendations? Did you have a foreshadowing of what they would be?
I did not. We did not get into any substance about what those...
He wanted you to approve them.
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign. I did not resign, and that is when he told me he had already spoken to the White House about having me removed.
Did he ever communicate he was going to change the childhood vaccination schedule?
Not until that very day. In that morning meeting, he said that the childhood vaccine schedule would be changing starting in September, and I needed to be on board with it.
Did he ever suggest that he was speaking for the president?
In that morning meeting, he did say that he had spoken to the president. He spoke to the president every day about changing the childhood vaccine schedule.
Okay. Did Secretary Kennedy ask you to speak to anybody outside of HHS?
He did. In the second meeting that day, he indicated that one of his colleagues or collaborators, I don't know what the relationship is, was coming into town the following week, and he wanted me to meet with that person.
Who was that person?
The person was named Aaron Seary.
Aaron Seary, is he the trial attorney who wanted to get rid of the polio vaccine, allegedly, and President Trump slapped him down and said he couldn't do that? Is that the same Aaron Seary?
I don't know the second part of that, but I do know that there were public reports that he is the individual who had suggested getting rid of the polio vaccine.
Okay. Now, Secretary Kennedy told the Finance Committee that he did not ask you to pre-approve, but that you were biased against the new ACIP, and he just asked you to keep an open mind. Did he cite any data or science as relates to the potential ACIP recommendations to persuade you to support them?
He did not have any data or science to point to. As a matter of fact, we got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Okay. Dr. Houry, Dr. Monarez has just said the secretary directed her to accept vaccine recommendations without seeing them and for which there is no science. Related to tomorrow's ACIP meeting, who decided what would be on the agenda?
So I don't have great visibility into that. I know the senior advisor and HHS counselor worked with our staff and the designated federal official and proposed items.
Okay, and who is the senior counselor?
The senior advisor is Stuart Burns, and the HHS counselor is Ren Archer.
And those are political appointees answerable to the secretary?
Yes.
Is that the way does normally the cabinet secretary or political staff set the agenda for a scientific meeting?
Not for the past decade. I was at CDC.
So this is the first time that's been the case?
Yes.
And in preparing materials for the meeting, were you told to disregard science or to enhance science, or what were you supposed to do?
For the last meeting, we had developed...
I'm talking about this meeting coming up.
So for this meeting, we didn't have work groups other than one for COVID. So CDC scientists were being asked by ACIP to develop questions and recommendations. I did suggest additional questions that the hepatitis B work group look at so that they could look at differences in age groups. The senior advisor was concerned that could bias moving away from a birth dose. I asked how asking questions and providing data could do bias if we didn't have the answers yet.
Biased against moving away from, you're suggesting that they wanted to move away from the birth dose, but they were afraid that your data would say that they should retain it?
Correct.
That's okay.
Thank you, Mr. Chairman. Dr. Monarez, at a September 4th hearing in the Finance Committee, Secretary Kennedy called you a liar for stating that you were fired because you refused to pre-approve vaccine recommendations. Is that accurate? Are you a liar?
That is not accurate.
Why did you believe it was so important for you to refuse to rubber stamp vaccine recommendations without seeing them or the evidence behind them? What did you fear was the worst case scenario if you had agreed to doing that?
I refuse to do it because I have built a career on scientific integrity. And my worst fear was that I would then be in a position of approving something that would reduce access of life-saving vaccines to children and others who need them.
Okay. Dr. Monarez, the American Medical Association, the largest physician group in America, 270,000 physicians. The American Academy of Pediatrics, over 67,000 pediatricians. The American Academy of Family Physicians, representing over 125,000 doctors. The American Osteopathic Association, representing over 200,000 doctors. And the American College of Physicians, representing over 160,000 doctors. They believe that vaccines are safe and effective. Do you agree with them?
I do.
And what is your concern? What are the long-term implications for the well-being of our kids and the future of our country if faith in vaccine science is undermined?
I believe preventable diseases will return. And I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough. I worry about the ramifications for those children in illness and in death. I worry about our school systems. I worry about our medical institutions having to take care of sick kids that could have been prevented by effective and safe vaccines. I worry about the future of trust in public health.
Would you agree with me in suggesting that the overwhelming body of scientific and medical thought believes that vaccines have been a major public health advance for the people of this world?
I absolutely agree with that.
Okay. Dr. Houry, during your testimony, you talked about fears for the future. Several years ago, as everybody in this country knows, we went through a terrible pandemic, worldwide pandemic. We lost over 1 million people. What are if trust in vaccines is diminished, if moms do not take their kids in to get vaccines, older people don't get vaccines, what will that mean in terms of our ability to save lives if, God forbid, another pandemic takes place?
So we're already beginning to see that as we're seeing childhood vaccination rates decrease. For example, measles is down to about 92.8%. That leaves over 200,000 kids now at risk for measles. So we are at risk for measles outbreaks. And for the next type of pandemic, a novel pathogen, with some of the staff cuts we have faced, we have less ready responders. We have less visibility into global pathogens at this time as well.
What would have happened to our country, and in fact the world, if, and I don't agree with President Trump very often, God knows, but if we had not developed warp speed and developed that COVID vaccine, did that, in your view, save millions of lives?
Operation Warp Speed absolutely saved millions of lives and was such a godsend for our country.
And if we don't have the capability to do that in the future, the implications will be?
We won't be able to have vaccines to save lives and protect people. We won't have that technology development. We won't have that platform, and we won't have people willing to accept vaccines.
And that will impact not only our country, but people throughout the entire world.
Absolutely.
Okay. Thank you, Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman. Dr. Monarez, the recent turmoil at the CDC only serves to further undermine public confidence in its recommendations. You've had a very unusual tenure there, to say the least. You started out as the acting director and had a good relationship with Secretary Kennedy, such that he recommended your appointment to the president. Then you were confirmed by a unanimous Republican vote, but opposed by every Democrat and every independent in the Senate. Then, less than a month on the job, you were abruptly fired. So I want to discuss with you further the grounds for your firing, even though I recognize the president has that authority. But as many of us have said, we just changed the law to make the CDC director appointed or confirmed by the Senate. And thus we have a duty here. First of all, Secretary Kennedy replaced every single member of the advisory committee. Did he consult with you about any of the replacements?
No.
When you met with him on August 25th, you have testified that he asked you to approve the recommendations of the new members of the committee, regardless of what they were. Is that correct?
That is correct.
So Secretary Kennedy, in testimony before the Finance Committee, has denied asking you to do that. Is there any doubt? Could you describe the discussion that you had on that issue?
Yeah, I'm happy to. The secretary in that morning meeting was very upset, very animated, and he said, with regard to that particular topic, I have heard that you may not sign off on the forthcoming ACIP recommendations. And I said, I cannot sign off on something before I see the data and the evidence. And he said, and elaborated on this for some period of time, that there is no data and evidence, there is no science, that CDC has never collected the data, the evidence, and the science associated with the safety and efficacy of the vaccines, and that I needed to commit to signing off on each and every one of those recommendations. And if I could not commit to that, I needed to resign.
What are the implications for public health if important scientific decisions at the CDC are made by the political staff rather than the career scientists?
It concerns me. It really concerns me. As you are aware, and Dr. Houry can elaborate on, these are very important, highly technical discussions that have life-saving implications for our children and others who need vaccines. And if you don't have the commensurate skill sets or the ability to ask the right questions, and you're willing to sign off on decisions that are not made with the best available data and evidence, it does put at risk our children. It puts at risk others who need these vaccines, and it takes us into a very dangerous place in public health.
Dr. Houry, did HHS's response to the measles outbreak earlier this year differ from its response to other infectious disease outbreaks in your previous interactions with the department?
Yes, in several ways. First, I never briefed the secretary, as did the center director who oversaw measles never briefed the secretary. In an outbreak response, usually you would be briefing leadership. The second thing is he said things like vaccines had fetal parts, and I had to send a note to our leadership team to correct that misinformation. We were also asked to include things like budesonide and clarithromycin in our toolkits for physicians, and I couldn't allow that as there wasn't evidence for that and would result in harm.
Thank you.
Next is Senator Hickenlooper.
Thank you, Mr. Chair. Thank both of you for being here today and for your service. Time was really valuable. Let me ask a rhetorical question. Secretary Kennedy told our colleagues on the Finance Committee about vaccine access. He said, most Americans are going to be able to get it from their pharmacy for free. Everybody can get it. But that's not true, is it?
My mom lives in Virginia, and she was unable to get it.
Great. I mean, I realize with you out of office, you don't have access to those informations, but about half of all American kids get free vaccines through the Vaccines for Children program. This is now at a standstill waiting for guidance from the CDC. States by Colorado are trying to lead by issuing separate guidance for their states about vaccine access. Obviously, that's a lot of friction and confusion. Many insurance plans defer to federal recommendations to determine coverage of vaccines, leaving many families with bills that can range into the hundreds of dollars just for vaccines. And pharmacies across the country, from the confusion, they're not sure if they can administer the vaccine or even if they have it in stock. So I think we've got a real problem to navigate that we've got to be able to look at it. Dr. Monarez, during your tenure as CDC Director, your short-lived tenure, you tried to implement guardrails to reinforce the Advisory Committee on Immunization Practices, or ACIP. Given the Secretary's actions, do you still agree that we need those guardrails?
Yeah, what I was trying to implement was what I had testified here on June 25th is transparency, accountability, and integrity to the processes. And what I had proposed was transparency measures such that any information that was going to be used by the ACIP in a deliberative manner be made available to the public 6 weeks in advance of the ACIP meeting. A sufficient time that scientists, public health practitioners, and others would be able to see the information, see the data, and then watch the ACIP meeting, understand how that evidence was used to support the decisions, the recommendations that were coming forward. And then I had proposed that perhaps we would have a back-end transparency period of time where if there was new information that had been introduced or the way that the information was contextualized at the ACIP meeting, that we would have a second public comment period so that if there was additional...
No, I understand why you would have that.
Yep.
And obviously, those guardrails would still be needed. Is this something Congress should work on? I can ask both of you that.
I would highly encourage all of us, whether it's congressional action or others, to make sure that we do have the appropriate transparency and accountability measures. The ACIP deliberations are critically important and they impact real lives. And so the more that we can do to ensure that we are achieving radical transparency, accountability, and evidence-based decision-making, I would highly encourage it.
Right. And FACA does have provisions, the Federal Advisory Committee Act, and so I do think this is the perfect opportunity for Congress to ensure that CDC is following those processes. Those processes are there for a reason, to ensure that there's transparency, gold standard science, and that the public has the opportunity to engage.
Right, transparency becomes one of the keys. We're talking about trust here.
Yes.
And without transparency, you're never going to have trust in the modern world. In terms of pandemic preparedness, and Dr. Houry, I'll talk to you, and I love seeing where you did your training in Denver, Colorado, at Denver Health, which is my medical provider, just so we're completely clear.
I thought you meant Tulane, but that's okay.
Love both.
I want my 9 seconds back. Dr. Houry, given the layoffs, somewhere in the process of over 2,000 employees have been fired or attempted to be fired, In your testimony, you mentioned the CDC has seen a 60% decrease in flu samples and a 70% decrease in COVID samples. That's alarming. That's striking to me. What's the reduction? What's that attributed to?
So a lot of that is attributed to withdrawing from the World Health Organization. Many countries don't view us as the same level of partner. That's something that can be overcome, but it takes leadership to really proactively reestablish those partnerships so that we're not flying blind. We know what pathogens are out there.
Right. And I'll just leave a question. What keeps you up at night? What keeps you both up at night? Very concisely.
The next outbreak, and I don't believe that we'll be prepared.
I'm concerned about the future of CDC and public health in our country. Given what I have seen, if we continue down this path, we are not prepared, not just for pandemics, but for preventing chronic health disease, and we're going to see kids dying of vaccine-preventable diseases.
Thank you both very much. Appreciate it. Yield back to the chair.
And I will turn to, is it Senator Kaine?
Thank you, Senator Murkowski, and thanks to our witnesses for being here today. Dr. Monarez, I owe you an apology. When you were here for your confirmation hearing, I questioned you very significantly, not on your qualifications. You got over the qualifications bar easily, but my worries about the direction of HHS made me question you very significantly on your backbone.
You did?
A trait that is not in long supply in this town. And then when I voted against your confirmation, I cited that as the reason. Again, no concern about your qualifications. I had concern about your backbone, and I was wrong. And I apologize to you for being wrong. I think it's important when you're wrong to admit you're wrong. I want to ask you a question to follow up on an answer you gave to Senator Baldwin, and I'm not sure I heard it right, but were you instructed by the Secretary of HHS to not speak to senators?
I was instructed to not speak directly with senators.
And was that also in the August 25th meeting you described?
That was over the course. I had several engagements with the Secretary over that day, and it was in one of those meetings that I was instructed.
So confirmed CDC Director, Senate confirmed. We used to speak with the CDC Director all the time during COVID and during other emergencies, instructed not to speak to senators. Isn't it, is my memory right? Doesn't Secretary Kennedy say he's about radical transparency?
That is one of the areas he has prioritized.
Yeah, well, putting a gag order on a CDC director and directing her not to speak to those who have confirmed her and to whom she is responsible for oversight is a very serious matter. I want to talk about measles and finish with a question for Dr. Houry. Just really get in the minutia about measles. 1,454 cases in the U.S., 4 in Virginia, and I'm just going to give you about the most recent one in Virginia. School-age child, early September, 5 to 12 years old. Measles is really contagious, spreads through the air. You can contract measles when somebody has had it in a room, even 2 hours after they've gone from the room. Mm-hmm. And you often don't show symptoms for days. When this child with measles was identified and the case was reported to public health officials, our Virginia Department of Health had to spring into action. They had to find potential exposure. The child, while infected but before demonstrating symptoms, had attended school for 1 day and had visited multiple healthcare facilities. In 1 day, 1,000 Virginians were exposed to measles by this one child. The VDH coordinated with the healthcare community and the school district to contract trace 1,000 people, followed up with 800 people, including babies in a NICU too young to be vaccinated, had repeated contacts with these individuals to make sure that they weren't showing symptoms. The VDH has dozens of staff, about 50 were working on this issue. And within days of the knowledge of the case, the VDH had worked to notify all 1,000 people. Now they have to continue to monitor for another 21 days. 45 to 50 officials had to work just on this one case. I'm very proud of their work. And I'm sharing the background just so people understand how serious even one case of measles is. The Infectious Disease Society of America says the median cost for a health department to respond to one case of measles is $32,000. So just multiply that by the 1,454 cases this year, $46,464,000 already to respond to measles, which is at a rate that we haven't seen in a number of years. A case costs a median of $3,200, but the price increases as you're trying to contact trace. The median price to contact trace is $223. So for Virginia, just to contact trace 1,000 people, $223,000 for one case. I bring this all up because to make it even harder for states to respond, in March, Secretary Kennedy rescinded $11.4 billion in public health funding to states. To Virginia, our Department of Health lost $425 million during the worst measles spread we've seen in recent years. The money was being used to modernize the state's technology to allow it to better track and respond to outbreaks, to upgrade the state's epidemiology labs, and to support community health workers. 500 employees and contractors in Virginia have been laid off because of these cuts. This shouldn't be happening. Dr. Houry, did you or career scientists ever brief Secretary Kennedy about recent measles outbreaks?
We did not brief Secretary Kennedy.
Did you speak with any HHS or CDC political staff regarding the outbreaks?
With CDC political staff, absolutely. Our team did, like the chief of staff and our communications about measles. And I did want to just follow up on your point about funding. That's my concern. 80% of funding of CDC goes out to state and local communities. So as we see budget cuts to CDC, your community will see that too. And the boots on the ground work that you did in Virginia is exactly the heart of public health.
Thank you. So thank you so much for being here. And Dr. Monarez, I appreciate your time coming before this committee again. I'd like to go over some time frames first. But first of all, who fired you?
I believe the president fired me.
Okay. Do you serve at the will of the president?
I do.
And just for the record, the president's removal power is rooted within the Constitution, separation of powers, and are necessary to ensure that the executive branch officials are aligned with the administration's policy. This means the president can remove them at any time for any reason or for no reason at all. Would you agree with that?
I would.
Okay, so what day was you fired?
I believe I was fired on August 27th.
Okay, what day was the first time you seeked counsel? Not retained, seeked counsel.
I don't recall.
We can get those records, so maybe you should recall them, because I think you might have an honesty issue here that we want to point out. So, what day was it that you spoke to the attorneys the first time?
It was on or before the day I was fired.
No, that's when you retained them. You already testified to that. When did you speak to them?
Again, it was on or before the day I was fired.
So you retained them the first time you spoke to them?
I believe that I retained them the first time I spoke to them.
Was you let go in the middle of the night? Was you let go in the middle of the day?
I believe.
Now, I know the answer to this, so let's be honest here.
I believe I received. I believe I received an email from the White House indicating that my services were no longer needed.
What time was that?
Sometime in the afternoon, sometime in the evening.
Late evening, late afternoon, late evening.
Probably.
And so you got hold of the attorneys late at night?
I'm sorry, what?
You got hold of the attorneys after business hours to retain them?
I don't recall.
I think you do.
I really.
I think you don't recall. You don't recall retaining your attorneys.
I don't recall the specific time or day that I returned them.
See, I still think you have an honest issue because it wasn't that long ago. And I think I could recall when I hired an attorney. And I could definitely recall the time I did it. Now, let's when did you remove the political appointees from the floor that you work on?
Again, I did not. I moved some political appointees in, and I put my senior advisors together.
When did you remove them and remove their access to your floor? And you had a conversation with the secretary about this. When did that happen? Like how many days into your job?
I'm sorry, I don't even know what you're asking.
Yeah, you do, because you already talked about political appointees that the secretary had put in place. You removed the political appointees that was in there when you first got to your work. When did you remove them from your floor and take away their ability to access your floor? And you know exactly what I'm talking about because you and the secretary spoke about that.
You're miscontextualizing.
No, I'm not. I'm asking the question, what day did you remove them?
I have one political chief of staff. I have 3 political chiefs of staff. I had space made for all of them in my suite.
When did you remove the political appointees or the political hires before you got there? That was there prior to you getting there? This isn't hard. It's not hard. You talk in circles, and I just want an answer because you know.
So I had the security of my suite.
Okay, so let me ask you something. Your conversation with the secretary, you said that he said he didn't trust you.
Correct.
You testified to that. Is that really how that conversation went? Because there's other people in the room, and I think the conversation was, can he trust you? And your answer was?
He said he could not trust me.
No. The answer, ma'am, it was a recorded meeting. So you can testify one way, or you can prove that you're lying or give them to be honest with this committee. I'm giving you the opportunity to be honest here because you've been really walking around the edges and not being truthful. So did he ask you the question, can he trust you? And your answer was?
He told me he could not trust me. And I told him if he could not trust me, he could fire me.
That isn't how that conversation went. And you know that, don't you?
He told me he could not trust me, and I told him if he could not trust me, he could fire me.
Ma'am, all we're looking for is you to be honest, and you haven't been. You're not being honest with the conversation you're having. You're not being honest with the timeline, and you won't even give the answers of who your attorneys were. And all we're looking for is you to be honest. If we're going to have a hearing and we're going to discuss certain things, let's make sure we're talking with someone that we can trust your answers. It's like my kids. I tell my kids all the time, you know, one thing I want from you, I can deal with any situation we walk into as long as I know you're being 100% honest with me. The minute I can't tell you're being honest with me, I can't trust you. From then on, everything you say is questioned. And you have to question you because your personality and your answers aren't correct. Therefore, I yield back.
Well, is that a vote? I understand Senator Mullin implied there was a recording of the meeting or meetings between Dr. Monarez and Secretary Kennedy. I will note that if materials have been provided to Senator Mullin and invoked in official committee business, they are committee records, and all other senators on the committee have the right to see those records. I will also note, if HHS has a recording, I asked them to release the recording. I'd also like to know why it was recorded. But releasing the recording would be radical transparency. And this is about fulfilling the president's vision of radical transparency. This is allegiance to President Trump's values. And so I'd ask that that recording be released. I'll also note that we put in a request for any documents or communications that would bring transparency to the situation. We have not yet received those documents. If a recording does not exist, I ask Senator Mullin to retract his line of questions.
Mr. Chairman.
Let me see one more thing. I'll also note that if he has it, I'm also curious why only one senator was given this and why we're just hearing about it now. And why didn't the secretary share it at the Senate Finance Committee? But those are questions that can be answered later. With that, Senator Sanders.
That's exactly the point that I want to make. I mean, how does it happen, if it is true, that one senator has access to an alleged tape recording of a meeting? Nobody else has it, including the chairman. This is what we're dealing with right now. And this is what I think, well, Dr. Monarez, this is a very politicized situation, and it's unfortunate. Thank you.
For the record, it's just been reported that Senator Mullin told reporters that he was mistaken in saying that the RFK Monarez meeting was recorded. But in case he's mistaken that he was mistaken, if there is a recording, it should be released. And it would beg the question of what other conversations were recorded. And I'll repeat what I said earlier. We have sent a request to HHS for records related to these incidences. We've yet to receive those. But of course, it would help the committee, which on both sides has found itself scratching its head. It would help us kind of discern what the truth is. With that, I go to Senator Alsobrooks.
Thank you so much. Good afternoon, Dr. Monarez, and good afternoon, Dr. Houry. First of all, I want to thank you for being here today. This is a charged political environment, and being here today took courage. So I want to thank you for your courage. I also want to thank you for your commitment to the truth. Speaking of the truth today, it's been mentioned that there was a, quote, honest problem or honesty problem. Secretary Kennedy in this very room said that he would not fire scientists who were career scientists or working scientists, and he lied when he said that. And so I want to just question first, Dr. Monarez. I want to talk to you about the series of things that happened on August 25th. You've described the meeting as animated. I will say it sounded unhinged. But I want to ask you whether Secretary Kennedy, what rationale did he give you for firing career scientists? What did he say the rationale would be?
Yeah, I mean, that was a sequence of events where he had articulated his longstanding concerns related to the CDC, and that the career scientists were part of a group that was part of the most corrupt federal agency in the history of the world, and a number of different items that he had ticked off, including that the CDC employees were killing children and were bought by the pharmaceutical industry and forced people to wear masks and social distancing. So there was a number of different contextual items that he offered related to why those CDC scientists should be fired.
And during that unhinged conversation on August 25th, did he also indicate that he had asked leaders at other agencies within HHS to carry out similar directives to fire scientists and senior officials?
He didn't use the word scientists or senior officials, but he did say that others, and I have, again, no way to substantiate this, but that others at the other organizations, FDA, CMS, and NIH, were engaging in a similar practice of turning over leadership and getting to an organization that would be aligned with his priorities.
So in other words, substituting scientists with people who would rubber stamp his views and opinions.
So he didn't use those exact words, but the idea was to get to an organization that would be aligned and compliant with his administration priorities.
Now, how did he tell you, again, how you should comport yourself with political staff or more specifically his allies? What did he tell you about that?
He said that I needed to surround myself with the politicals and that I needed to listen to them and that I needed to support them with everything that they needed and that I did not need to engage with any of the career scientists.
And again, just so we're reminded, where were you immediately prior to this meeting?
Immediately prior to this hearing today?
Yeah, well, to the meeting on the 25th.
Oh, I'm sorry. Yep. I was, the previous week I had spent in Atlanta with the CDC staff post the shooting, doing a number of activities to make sure that I could ensure their security, help them with the healing process, and then continue the CDC mission.
So I want to ask you very quickly about that. At 5 p.m. on August 8th, a gunman opened fire at the CDC headquarters campus in Atlanta, Georgia, forcing thousands on the campus to lock down. Now, did you receive a call from the secretary upon the first reports that an active shooter on CDC headquarters had shot at employees?
I did not speak to the secretary on the 8th or any successive day. I did not speak to the secretary until August 11th when he came down to visit.
So are you telling me that the Secretary of Health and Human Services failed to even give you a courtesy call upon learning that employees there had been shot at?
He did not call me.
I want to ask Dr. Houry very directly, do you believe that Secretary Kennedy is incompetent and dangerous to the American people's health?
I always believe in optimism and hope, and I would say that was my hope when he started. I had read his books, and as a transition lead, I was prepared to welcome him. After seeing his Senate finance testimony and the number of misstatements, seeing what he has asked our scientists to do and to compromise our integrity, and the children that have died under his watch, I think he should resign.
And finally, I just want to use the last 20 seconds or so I have, Dr. Monarez. You've said you agree with the president that vaccines are not controversial because they work. And I am a mother. You are a mother. I would like you to take the last few seconds I have to talk to parents. My greatest concern would be confused parents who have kids who are going to kindergarten, going to daycare. What do you say in this moment about these parents and what should they do regarding vaccines?
Vaccines are safe, they're life-saving, and I would encourage any parent who is concerned about whether or not their child should get a vaccine to talk to their pediatrician, to understand the benefits of these life-saving medical products and to make the best decision that they can to make sure that their children remain healthy and happy and can go to school and be safe.
Thank you both so much for your integrity and for being here today. Thank you.
Thank you, Senator Brooks.